What are the topics that will be in your practical exams? Can you tell? What have we covered and what will be there in your exams?
Dose adjustment, then intravascular subcutaneous ADR, prescription,
Everyone know what are the topics will be there in your exam? Okay, so one is dose adjustment, one is ADR. Okay, this will be carrying 20 marks. Okay, so you have to know it very well. How many of you didn't got last? Anyone left? So first is dose adjustment, okay, and another one is ADR. So this will be carrying most of your marks, okay. That is 20, 40 marks, okay. So you have to know it very well, okay. For this we have kept it separately, okay. These two topics. So in dose adjustment, what does it mainly cover? The calculation part, okay, of which.
Loading dose, maintenance dose, pediatric.
So the special groups were the pediatric groups, the geriatric groups, the renal patients, then hepatic patients, cardiac patients. Okay, so here we will be focusing on the two groups. Okay, I won't be going into their details. Okay, but before going to this, do you remember this part, the dilution and the strength, which was taken in your lecture theaters? What does this mean? This 1% solution in for solids in solids, 1% solution means what? That means 1 gram of solute, okay, that is dissolved in 100 ml of solution, okay. And for solid, okay, it is means the number of grams, that is active constituents in 100 gram of the formulations. And in liquid means volume of the active constituents in 100 ml of solution, okay. So here more clearly when we come if we have to propose in strengths, okay, such as in ratio, that means 1:1 ratio, that means 1 gram of solute is present in 100 ml of the solvent. So in per ml, how much solute will be there? That is 1 mg, okay. So this is a bit mathematical, okay. So here if it is 1:100 ratio, so the percentage will be 1%, okay, and concentration will be 10 mg per ml, okay. This should be your basic concept, okay. And if you increase the ratio from 1:1000, the percentage will further decrease to 0.1 and it will come milligram per ml solution, okay. Then further if you go from 1:10,000 ratio, it will further go, that is 0.01%, that is 0.1 milligram per ml solution or 100 microgram, okay. 1 milligram equals to 1000 microgram, okay, per ml. And if you further increase, that is 1:1 lakh solution, that is 0.001%, that is 10 microgram per ml solution, okay. This is the basic concept. So with this so here just to make you in the for processing, okay. So if this 5 ml of solution contains 10 mg of the solutes, okay, so in 1 ml it will contain 2 mg. This is the basic, okay. So hence 1 ml should be present in 2 milligram of the drug to be administered, okay, if 2 mg should be administered, okay. So here, do you remember the calculation, the formulas? In pediatric groups we use two formulas, the Fried formulas, okay, and one more formula was used, that is the, we forgot, Young's formula. These two formulas we used, okay. So for pediatric patient we use these two formulas, okay, adult dose multiplied by age in months, then on the basis of body weight, adult dose multiplied by body weight in kgs divided by 70, okay. Here 70 is the ideal weight. So this were the formulas, and this was another formula for calculating the dose, okay. So for adult it is adult dose multiplied by weight by 70, or for pediatric also this you can use on the basis of body surface area. If body surface area is there, adult dose multiplied by body surface area, that is also in this unit. So this will be again in another formula, that is square root of height in centimeters multiplied by weight in kgs divided by formula. Okay, so these were the formulas for BSA. There are two formulas, that is Mosteller formula and one is Du Bois formula. Okay, so on the basis of this and one more, in case of renal patients, renal insufficiency or renal disease, with this formula we calculate the dose, adult dose multiplied by creatinine clearance in renal insufficiency divided by creatinine clearance in the normal individual. Okay, so what is the creatinine clearance in normal individual? What we consider? Do you remember? Huh? That is, what is the normal? Forgot. Okay, so further in males, if you want to calculate the creatinine clearance, okay, this is the Cockcroft-Gault formula. So here this is the formula, and for female just we have to multiply it by 0.85. okay, so this is the normal clearance, okay, of creatinine, that is 100 to 120 ml per minute. Okay, this is the normal in a 70 kg ideal patient. We are taking the weight of the patient, that is 70 kg as ideal, okay, healthy patient. Now you have to do the problems. Okay, let us see if you, how much you are prepared for the exam. Okay, do the first one. Just put the basic things in the formula and tell the result. Okay, quick. This is a revision class. What is the dose for this 35 kg pediatric patient if the adult dose is 70 kg? Patient is 500 milligram. What is the formula? Adult dose by, okay, do it. What is the result?
250 mg.
250. How you have come?
Adult dose into body weight divided by 70.
Okay, what is the adult dose here? 500 multiplied by 35. Okay,
Divided by 70.
divided by 70. Okay, everyone understood? Huh? Any confusion? Okay, let us go to the seventh problem. Try to do this seventh number problem.
Creatinine clearance taken as 100 answer comes 20 mg 3 times.
20 mg. Others, whatever others. Others you are getting or not getting? This is just a formula. You have to know the formula. What is the formula? Dose calculation formula, and you have to directly put it there. Okay. Others. Others have done? Huh? What is the formula? What is the formula here? What is the formula we are using? Total dose calculation, that is adult dose multiplied by, you have not written the formula, why not written? Adult dose multiplied by creatinine clearance in renal insufficiency divided by renal insufficiency divided by creatinine clearance of the normal patient. So here the adult dose is how much? So here they are saying gentle machine it is 80, isn't it? So for 80 you have to divide it, you have to multiply it with by 50 multiply with what? $80 by 70. So this is the formula, isn't it? Calculating the dose. So here, what is the adult dose? It is given 80. 80 into, it will be 80. It will be what? Adult dose means what? Adult dose means if it is in case of antibiotic, the dose comes in total per day dose. Okay, so the dose was 80 3 times, isn't it? So 3 times means you have to multiply it, isn't it? 80 multiplied by 3, that means 260. So 260 is the total dose. Okay, total adult dose. Sorry, 240. 240 is the total adult dose. Okay, so we got the adult dose. What is the creatinine clearance of this patient? 25 multiplied by 25 divided by 100. Okay, so what is the answer? 60. Okay, so if it comes 60, that means this is the total dose for the day, for the whole day. So it was how many times? 3 times. That means 20 mg per day. Okay, understood everyone? Any confusion? Any confusion? Last bench? Confusion? Acha. So let us go to this other basic. Okay, basic. Try to do the first one. Calculate the dose of the paracetamol in 6-year-old child, while adult dose is 500 mg at the time of fever. So here, what is the formula? Above 6 years. Which formula we use? The Young's formula, isn't it? So here, 150 mg. So here, what is the formula here?
Adult dose 18 years by
18 years
20.
By 20? It was 20 written. Which formula you are using? Little Young's. Dilling's formula. So, okay, so if you use Dilling's formula here, You can use, okay, Dilling's formula also. Adult dose is how much here? 500. Modular age in years. What is the age? 6 years. 20. What is the answer? 150. Everyone got 150? If you are using this, okay, the results might differ if you are using different formulas here, okay? You can use, okay, no restriction is there, okay? You can use. What I'm saying, if you are using different formulas, the result might come different, okay? They used the Dilling's formula, you can use Young's formula. That is what I'm saying, okay? The result might come different, okay? Okay. So, to the this master and last one. To this last one. Okay, wait, don't do this one. You do this one, okay? This first one. Tonsillitis one. You do this one. So here the age is given, weight of the patient is given, and the dose is given.
Six. What is the answer? 3.6. Which formula are you using? Which formula are you using here? See, there are two rules, okay? There are two formulas, okay? The first one was the Fred's formula and second one was the Young's formula, okay?
but this Fred's formula is most commonly used. Okay, so this you can use this Young's formula also, but most commonly this Fred's rule is used. Okay, so first try to, if you're having in confusion, first go directly to this rule. Okay, this age barrier is written here, but normally we don't usually go. Okay, so first try to do with this. Okay, with this one. Okay, this is widely accepted. Okay, and near to accurate the results comes. Okay, so if you're using this formula, okay, here, so here if you're using this, so here you have to calculate the adult dose. So what is the adult dose here? 12 mg per kg. Okay, so here, so it is the normal ratio. Okay, so here if you want to calculate the adult dose, you have to multiply with the adult weight, isn't it, first? So then it will be the adult dose. So you have to multiply with by 12 multiplied by 70. So it comes 12 was the 12 kg, isn't it? 12 kg per mg. Okay, 12 mg per kg. So what is the adult weight? Adult weight we take 70. So first to calculate, to bring this to the adult dose, you have to multiply with the adult weight. So 12 multiplied by 70, how much it comes? 84. So 840. Okay, 840 milligram. So this is the adult dose. Then put in the formula. Then put it in the formula and see what comes. Yes, around 252. Okay. What did you got? नितिन बताओ कितना मिला है? Just put it in the formula. $252. Okay. 252 others. Others got 252. Or still having confusion? Here I am just what I told. This is the most commonly used. Okay, this Fred's rule. So here if I take this formula, because the weight is of the patient is given here. Okay, if I take this and if I calculate the adult dose and put it in the formula, it comes around 252 milligram per day. Okay. Any confusion? Others? You didn't get. Why didn't get? What is the formula? You got the question? You didn't get the question?
I didn't click it. Come from
Who is the next one? Next slide. Go more. Where is the calculation? You have not written that one? No further slides. This one, yes. See, it is written, na? What I told, this is the most widely accepted. Okay, this age barrier is not there. It's an up to 2 years, isn't it? So first go with this Fred's rule. Okay, so the body weight has been given, only the adult dose we need, isn't it? So the dose was just given for the day, but not according to the age, okay, or weight of the patient. Okay, so it is just written 12 milligram per kg per day. So for this adult dose calculation, you need the adult dose value, isn't it? So the ideal weight is 70 of the adult. Okay, so you have to multiply the 12 milligram with the 70, then only we get the adult dose. Then we put in the formula. Okay. Okay. So let us go to the ADR. Okay. In ADR, what is the most important thing? In ADR? ADR reporting. Okay. So ADR reporting. So this will be there in your exam. Okay. So remember this chart, causality assessment. Remember this. Remember? Okay. So here we have some causality terms like certain, probable, and possible. Who can explain it nicely? Who can explain it nicely? Who can explain it? Pritam. Rasa telling Pritam, name of Pritam. Can you tell basic difference between these terms?
So certain means that we are 100% sure that this has caused the adverse reaction. There has been an adverse reaction. Probable means there is a higher probability, higher chance that this has been caused.
Others listen.
Possible is more like 50-50 chance, and unlikely is less than 50% chance.
So if you are having any confusion here, it is like mathematics. Okay, if the answer comes correct, full marks 20. If the answer is 0, means 0. So you have to make it correct. Okay, the result has to be correct. So here you need to understand these terminologies. Okay, before going into the causality assessment or ADR reporting. Okay, so here what is the difference between certain, probable, and possible? So the first one, it is the certain. Okay, so here I am just explaining in basic. Okay, so the basic difference is when we give a drug to a patient, this is known as challenge. This is known as challenge. When we primarily introduce the drug, okay, the primary introduction, that is the challenge. When we withdraw the drug or stop taking the medication, that is the de-challenge. That is known as de-challenge. Okay. The third term is the re-challenge. When the same drug in the same composition, in the same dose, it is given to the patient. Okay, same drug, same composition, same dose, it is given to the patient. That is the re-challenge. Okay, certain effects are there. Okay, so this is so when it is certain, that means challenge, de-challenge, and re-challenge of the primary drug is there, and there is relation with time. Okay, this is the primary difference. Okay, in this probable, primary introduction of the drug, that is challenge is there and de-challenge is there. Okay, that is stoppage of the drug. Okay, the drug is not given. Okay, this is the basic difference, and also time relation is there. The third one, that is possible. Okay, when the drug is been given, okay, then de-challenge is not there. Okay, you are not sure. Okay, the drug is given and there is action continued. Okay, so this is the basic difference. Okay, so with this, let us go to the problems. Okay, I think you have done. Okay, just for your revision. So you have seen, you have got the forms. Okay, everyone have got the forms reporting. Anyone left? So here in this form, okay, the first part, that is the initial part. You can see the initial case written. Okay, so this is initial or follow-up case. Okay, first there are two options, then next is patient initials. Okay, the information of the patient. Okay, you have to write there. Event, that is starting date of the reaction, stopping date of the reaction there. Then next is you have to describe the reaction. Okay, what happened or with what patient is suffering from. Okay, then next comes the suspected medication. Excuse, which drug caused it. Okay, then comes action taken of the reaction. So what actions have the patient been given, okay, after the reaction has happened. Then comes an investigation with dates, then any medical history is there, then seriousness of the reaction, okay, whether the patient is dead, life-threatening, hospitalization, okay, then outcome, finally, whether the patient is recovered or not, okay. Then lastly, that the concomitant medical history, it is not required, okay, as of, okay. Then last is the reporter details. okay, your name, okay, who have given the reporting, okay. So start doing it. Let us see, you can do it. To the first case. Each and everyone have to do it correctly, okay. This is the reaction date. First read it. ADR means what? What is the full form of ADR?
Adverse drug reaction.
So when did the reaction happen? Okay, that is the first one.
So the patient improved gradually over 3 weeks. Improved এটা তো recovered হবে না নাকি recovering?
Improved.
Recovering. Improve না তো recovered.
যেটা ঠিক মনে হলে আমি এরপর কারেক্ট করব if you are wrong. Who called me? You. You have to describe the event. What had happened to the patient?
Severe itching.
There is a format I have told. You are from the regular batch? अच्छा ठीक है. Okay, if you are having any doubt, just wait. Okay, I'll clarify. Others? There is a format. Okay, there is a format how to write it. I have told it. If you are having confusion, wait. Okay, I will tell you. So let us start, okay. Others try to see, okay. So this is a initial case or follow-up case. This is a initial case, okay. Initial case, mark it, okay. Then patient initials, name of the patient Lata Shaha, okay. Age is 45 years, okay. Next is gender female. Then reaction starting date. So date of onset symptoms yesterday. So yesterday's date, okay. Yesterday was 8th Feb, okay. Then reaction stop date. So patient improved after gradually over 3 weeks, okay. So plus 21 days. 20 days at 29. Okay, so 21 plus 9, that is 1st March, okay. So this is the reaction stop date, ठीक है. Then describe the event and reaction management with drill. So how will you describe? So here, so when we used to take the history part, okay, in patient illness, how do we describe it? First you have to write that the patient was a known case, okay. KCO, or patient is a known case of this, okay, that is major depressive disorder, and patient was under medication. Which medication? Yes, this fluoxetine, okay. So under medication, after 2 weeks of taking the medication, she developed severe rash, itching, swelling of the face and lips, breathing difficulty. So this way, this is the format, okay. Now here in this you have described the reaction, okay. Now the next comes the diagnosis. What is the diagnosis here? Stevens-Johnson syndrome, SJS, okay. This is the diagnosis. Fluoxetine induced Stevens-Johnson syndrome, okay, because this was the drug she was taking, and after that the reaction started, okay. So this fluoxetine induced Stevens-Johnson syndrome is the diagnosis, okay, diagnosis. After that, management. What is the management she was given? You write MX, okay, MX. Under MX you write what are the things. First she was given corticosteroids, okay, first is corticosteroids, second is antihistaminics and other supportive cares, okay. Wound management along with hydration, okay, she was given. So this is the management part, okay. So here next comes advice, okay. What advice? So this drug was discontinued, okay, this will be under advice, okay. Now next comes suspected medication. What is the medication here? Fluoxetine. If brand name is there, you write the brand name. Project, project written. Manufacturer is not written there, okay. Then batch number, it is also not given. Expiry date
1 year after.
1 year after, okay, 1 year after 2027, okay. Then dose is given, dose is not given here, route not given, frequency not given, okay. Therapy on which day it was started?
24/1.
So the reaction started on 9th or 8th. So 2 weeks back. 2 weeks back. What is the date comes? 25. 24. Okay. So 2 weeks back. Okay, the date. Okay, calculate it. Then date of stopping. When did it stop? 8. Yesterday 8. Okay. 8 Feb. Okay. Then what is the indication for this medication? Why the drug was taken? This drug. Major it is given. Yeah. Major depressive disorder. Yes. Then causality assessment. Tell me. Others? Middle bench, last bench. Causality assessment. What you have written? Probable. Why probable? Explain. It should be clear why you are writing probable. I have told the basic thing. I have asked you. Why probable? Others? What have you written in causality assessment? Well, probable. Why probable? Any reason? It might be. Did I told might be in probable? Did I told might be? So in probable, in certain 3 things are confirmed. Okay, challenge, de-challenge, and re-challenge. In case of probable, challenge and de-challenge is there, not re-challenge is there, isn't it? So here the causing drug, okay, this fluoxetine was discontinued. Was it given? So the discontinuation is clear. The history of discontinuation is clear. So it comes under Probable. That is why the causality assessment, this is the probable. Understood everyone? Okay. Next, relevant investigation. Okay, so the next comes is the action after reaction. Drug was withdrawn. Okay. Other things are there. Then comes relevant investigations with dates. Any investigation is there? Not there. Okay, if it is there, you have to write. In medical history, you have to write. Okay, if it is there, no, write nil. Okay. Then seriousness of the reaction. Hospitalization. Okay, this is a case of Steven Johnson and it should be hospitalized. Okay. Outcome. Others are agreeing. Recovered. Dibojati. Recovered. Clear. Then reporter's details. Okay, your details you have to write. Okay, along with the date of reporting. Okay, if you are writing today, then today's date. Okay. Okay. Now let's next go to the problem. Six, seven. Edge.
প্র্যাকটিক্যাল ক্লাসে হয়ে যায় তো ওইখানে গিয়ে সেটা তো আইএমএসিটা দেখো আর আমি একসাথে আমি আসলে আর আমি কি দেখা যাচ্ছে
কোনটি ভাগ করে
হ্যাঁ একসাথে করে নিলে বেশিক্ষণ তো লাগতো চেষ্টা করে দেখা দেওয়া তুমি মুখে ব্যথা কম করে দেবে তারপরে নেক্সট ইয়ার আসবে আমি দুই ভাগ করে
দেরিব কিন্তু
দেরি তো চেষ্টা করতে পারছি
আচ্ছা এটা করলে শেষ হয়ে যাবে do this. You also need? You didn't got 2? Then why you have not said? Huh? When I asked? You also need? Initial or follow up? Okay. Okay. So patient initials Shranto A. Gupta, 30 years, male patient. Okay. Weight is given 68 kg. Okay. Then comes event or reaction starting date 12/12/25. So this is the starting date. Stopping date? Huh? Same day. Acha. So here the reaction occurred once or twice? Twice. So it should be, so the time should be twice, the date should be twice. Okay. So first is happened on 12/12/25. Again it subsided. Okay. Reactions subsided within that day. Okay. Same day 12/12/25. So next day it again start, isn't it?
So next day it was
After that, after that day it was given.
नहीं नहीं उस दिन को और नहीं दिया
उसको ही day one
डे
Try-
का बाकी नहीं दिया डे 2 में दिया
So here the vancomycin dose was how many times? QID, isn't it? Okay. So the ceftriaxone dose was twice and it was QID. So here only the vancomycin, okay, was withheld. Okay. The next dose was withheld, isn't it? After the reaction, he was treated with injection phenonamine. Following the reaction subsided, injection ceftriaxone was continued. However, next doses, okay, of injection phenonamine on the day 1 were not given. Okay. Then on day 2 again it was given, isn't it? It was reintroduced and similar reaction appeared, and again.
So do we have to write 12,13? Do you have to write twice or just start 12?
You write D1, okay, day 1. In day 1 you write 12/12/25. Subsided day 1 12/12/25. Okay. Then on day 2, D2, that is 13/12/25, it started again, and again on day 2 it subsided 13/12/25. Okay, you write in this way. Okay. So twice the reaction happened, twice it subsided. Okay. Then describe the event. How will you describe? How will you describe? How will you describe? Tell.
Patient diagnosed with bacterial meningitis given ceftriaxone and vancomycin. After administration of vancomycin, patient developed chills, rashes, urticaria, and fever. Treated with phenidramine. Effects reappeared on second day of vancomycin. Ceftriaxone was continued.
Don't write patient diagnosed with. What I said? Known case. That is why I am using the term. Okay. Known case of bacterial meningitis. Okay. Under medication, injection vancomycin and injection ceftriaxone. Okay. Write the doses also 1 gram and 500 milligram. Okay. Then on day 1 after the first dose of ceftriaxone at 8 am, after the first dose of injection vancomycin at 9 am. Okay. After the first dose of the vancomycin, then after 10 minutes of the second dose, the patient started developing chills and rigors, isn't it? Okay. And intense flushing. Okay. So one you have to write on day 1 and one you have to write on day 2. Okay. This way you have to describe it. Okay. As the symptoms appeared. Okay. So after describing it on day 1 and day 2. Okay. And after subsidation of the complaints, then you have to write that diagnosis. What is the diagnosis here? Allergic reaction. So the diagnosis is which drug? Vancomycin induced or infusion reaction. Okay, happened. So here what is the management given? Injection phenidramine. How much? 25 mg IM. Okay, on day 1 and day 2 it was given. Okay. Next comes suspected medication. What is suspected medication here? Vanzit. Okay. Vanzit manufacturer is Swatch Healthcare. Batch number KKIL098. Here you have to write the whole. Okay. When you have started and when it ended. Okay. Then indication is for bacterial meningitis. Here what is the causality assessment? Why certain? Re-challenge. Re-challenge was there. And everyone understood? Okay. Why we are saying certain? Okay. Action taken after reaction? Withdrawn. Then dose increase, decrease, it is not there. Then reaction reappeared after reintroduction? Yes. Then any concomitant medication? Okay. Phenidramine is concomitant? Any self-medication or herbal medication the patient is taking?
So ceftriaxone would be concomitant, right? It's given alongside.
Read it, what it is written, including self-medication and herbal. Okay.
ये तो रिएक्शन होती है लोगों को बहुत है सिंपलिफिकेशन के साथ पहले से दिया था मुझे भी ये नहीं समझ आ रही है पार्ट कैसे दो
एक साथ next will be
हाँ तो इधर ये होगा
So here what will be, what you have written in concomitant? Ceftriaxone. Acha. Other things? Other thing is there? Self-medication, herbal. Okay. Write the dose. Okay. These things. Then any relevant investigation is there? Relevant investigation? Not there. Relevant medical history? Not there. Seriousness of the reaction? Huh? Hospitalization. Okay. Outcome is? Recovered. Okay. Date of report? 2 days. Okay. Your reporter details. Okay. Understood? Confusion anyone? Acha. So now your class will be on this oral. Okay. This dosage forms. Okay.
थोड़ा कुछ याद है या सब भूल गए? ओके, सो हाउ मेनी टाइप्स आर देयर? डू यू रिमेंबर? हाँ, इनहेलर एक मेडिसिन का कितना टाइप हो सकता है?
सस्पेंशन,
3 टाइप, सॉलिड, लिक्विड एंड सेमी सॉलिड. ठीक है, दैट्स व्हाट आई एम आस्किंग. ठीक है, फिर सॉलिड में क्या रहेगा? टैबलेट्स वगैरह, कैप्सूल्स. ठीक है, और लिक्विड में सिरप्स. ठीक है, और सेमी सॉलिड में ऑइंटमेंट्स. ठीक है, चलो इतना तक हो गया. समझ में आ रहा है ना? ठीक है. नाउ दिस थिंग्स विल बी योर स्पॉटर. तो तुम लोगों ने मोनोफेजिक एंड बाइफेजिक लिक्विड के बारे में पढ़ा था ना? यू रिमेंबर समथिंग? कुछ याद नहीं है? एनीवन? मोनोफेजिक लिक्विड क्या है? बाइफेजिक भूल गए सब? ओके. मोनोफेजिक इज समथिंग जिसमें सिर्फ एक ही होता है. ठीक है, देयर इज ओनली वन टाइप ऑफ लिक्विड प्रेजेंट. ठीक है, फॉर एग्जांपल सिरप्स. ठीक, बाइफेजिक में 2 तरह का होता है. ठीक है सर. वन इज योर oil emulsified and water, another is water emulsified. ठीक है, दिस वन इज बाइफेजिक. समझ गया? इतना तक ही जान लो, बहुत है, काफ़ी है. ठीक है. नाउ दिस थिंग इज सस्पेंशन. या ठीक है, सस्पेंशन क्या है? सस्पेंशन इज समथिंग where the particle, the medicine particle is mixed in the liquid phase or the water. ठीक है, it's suspension. ठीक है, वहाँ पे तुम्हारा when you will take it in your hand, you can feel that there are some coarse particles. ठीक है, so these are suspensions. ठीक है, देख लो, स्पॉटर में आएगा तो बोलना है सस्पेंशन है. यहाँ पे लिखा हुआ है. ठीक है, पास इट अराउंड, देख लो एक बार. नाउ दिस इज सिरप. ठीक है, सी देख लो, स्पॉटर में आएगा, इतना तक ही बोलना है बस. Now you guys know about tablets and capsules, right? Identify and differentiate कर पाओगे ना? Sure? गलती मत करना यहाँ पे. Tablets and capsules में identify and differentiate कर पाओगे? Sure? चलो. Now you MDI याद है तुम लोगों को? मीटर डोज इनहेलर याद है? प्रोसीजर्स याद है? किसी को याद नहीं है? अरे यार तुम लोग, हाँ क्या? चलो देख लो एक बार सब लोग कैसे करना है। दिस इज अ प्रोसीजर, इफ यू वांट यू कैन कैप्चर द फोटो। इसको रट के रखना है एंड बोलना भी है। हो गया? चलो तो पहले क्या करना है, कैप को रिमूव करना है, ठीक है। यू हैव टू रिमूव द कैप, ठीक है। फिर इसको शेक करना है, ठीक है। फिर मुंह में कैसे रखोगे इसको, प्लेस कैसे होगा, कवर द लिप्स, ठीक है। फिर ओके, इसके पहले ब्रीथ आउट करना है, ठीक है। फिर यू हैव टू टेक वन पफ एंड इनहेल वेरी स्लोली, ठीक है। इनहेल करने के बाद 10 सेकंड तक रोक के रखना है सांस को, ठीक है। फिर अगेन एक्सेल, ठीक है। फिर इसको 1 मिनट के बाद रिपीट, ठीक है। इतना ही है स्टेप्स। नाउ दिस इज MDI मीटर डोज इनहेलर। पार्ट्स के बारे में पता है, कैनिस्टर, बूट, माउथपीस, ठीक है। 3 पार्ट्स है। नाउ दिस वन इज स्पेसर, इसके बारे में पता है ना, क्या करना है इसको। डू यू नो व्हाई इट इज यूज्ड? यूज क्यों होता है ये? अरे डोंट टॉक टू योरसेल्फ यार। यूज क्यों होता है? चलो दिस वन इज स्पेसर, ठीक है। इसमें पार्ट्स देख लो एक बार। दिस इज द माउथ पीस, ठीक है। ये वाला पार्ट जो है, दिस इज द इनहेलेशनल चैम्बर, ठीक है। ये सामने वाला, ठीक है, इनहेलेशनल चैम्बर, ठीक है। और ये इस पार्ट को क्या कहेंगे, जहाँ पे माउथ MDI का माउथ पीस अटैच होगा, ठीक है, इन दिस एरिया। लाइक दिस, ठीक है, गॉट इट। और दिस इज द लॉक यहाँ पे, ठीक है। सो दीज आर द पार्ट्स। कैनिस्टर हो गया, बूट हो गया, माउथ पीस हो गया, ठीक है, MDI का माउथ पीस, और स्पेसर का यह रहा माउथ पीस। लॉक हो गया, इनहेलेशन चैम्बर हो गया, ठीक है, खत्म। नाउ यू हैव टू टेल द डिफरेंस, क्यों यूज करना है स्पेसर को, ठीक है। इट हैज़ ओनली सम 2 एडवांटेजेस। एक, बहुत टाइम के लिए तुम इसको इनहेल कर सकते हो, एंड सेकेंड इज दैट इट्स वेरी मच हेल्पफुल इन द पेशेंट्स ऑफ COPD, ठीक है। स्पेसर का बस इतना ही काम है। दिस थिंग इसको शो करके दिखाना होगा एग्जाम में, स्पॉटर में भी आएगा फॉर श्योर। यू हैव टू गो थ्रू इट बाय हार्ट, ठीक है। और यहाँ पे पैचेस शायद नहीं है, ट्रांसडर्मल पैचेस यू कैन आइडेंटिफाई राइट, जस्ट स्पॉटर में ही आएगा व्हाट इज दिस, ट्रांसडर्मल पैचेस, ठीक है। बस इतना ही। सो दिस आर द प्रोसीजर्स, ठीक है, जो तुमने पिक्चर क्लिक किया वही है, ठीक है। बस खत्म यहाँ तक। चलो अब समझ में आया ना थोड़ा बहुत? हेलो, कुछ आया, समझ में आया? यहाँ पे गलती मत करना। दीज आर वेरी इंपॉर्टेंट थिंग्स एंड वेरी स्कोरिंग, ठीक है। और एक चीज़, ORS, योर ORS इज वेरी मच इम्पोर्टेंट फॉर यू। ये आएगा ही आएगा। चलो गो टू योर प्रैक्टिकल। वहाँ पे जाना है.
Okay, so IM, IV, SC, and the cannulation. Okay, so the things are already done. Okay, now you are having any confusion? You want to clarify anything?
So could you show the intramuscular and subcutaneous and cannulation?
Intramuscular and subcutaneous
And the cannulation as well.
cannulation. What about IV? You know IV? Huh? So anyone who wants to know the IM or SC in this group? Anyone? So you know nicely. Come quick. Show them how to do the IM. How to give the IM injection.
So first we introduce consent.
You listen, okay?
Introduce consent and we'll explain the procedure.
First is introduction.
Introduction.
Second is
Consent.
consent. No,
No,
before
explain
consent.
the procedure.
Procedure explanation.
Then consent.
Consent. Then
Then we'll do the aseptic procedure.
hand washing.
Hand washing.
You know the 7 steps of hand washing. Okay. Then
Then gloves.
wear the gloves. Okay. You practice it. You buy Ferron. Okay. Then
Then aseptic precautions. First we'll locate the vein for IV.
IM.
Acha, locate the position for IM. Then we'll do the aseptic
What is the location?
deltoid muscle
Let's. Then
Then we'll do the aseptic procedure.
okay. What is the aseptic procedure?
Alcohol soaked cotton. We'll use it 3 times
Acha.
from outside to inside. Inside to outside.
Show them. 70% isopropyl alcohol from inside to outside circular motion we go. Okay. Then
Then we'll take the syringe.
after that air dry. Then
We'll take the syringe.
we'll take the syringe. Okay, suppose this is the syringe.
Then we'll check if the syringe is okay or not. Then after we'll remove the
No, before that you have
we'll
to
check the
label.
labels of the
Label. What are the things you'll check in label?
name,
Name of the drug,
name,
composition, then
expiry date,
manufacturing, expiry, then color, consistency. Okay, why consistency?
expiry date.
Consistency means what? Physical state, in which state is there. Okay, whether it is in liquid or dry form. Okay, or in the powder form. Okay, if it is in the powder form, you have to sometimes dilute it. Okay, after that, so if you're taking from the vial, okay, and if you're taking from the ampule, you know the difference between an ampule and vial. Okay, so this is what? Vial. So vial. So what is the how do we take from the vial the medication? Is there any step, anything? First, after checking the label, okay, here there is a plastic cap. Inside it there is a rubber cap. Okay, you have to remove the plastic cap. Then
we'll introduce the
no.
outside.
You have to disinfect this also. Okay, after disinfecting, how much solution you will be taking here? 1 ml. Suppose you are taking 1 ml. So how much air you will be? 1.1. Okay. That is equal number of air we will be introducing into the vial. Okay. Go. So this you will be introducing in such a way that what? So that the tip or the bevel of the needle is submerged inside the solution.
Introduce the air bubbles. Then we'll use the solution.
तू कहाँ से आया? हाँ? लास्ट में था. क्या कर रहा था? तू सो रहा था? बीच में क्या एप्लीकेशन लिख रहा है? क्लास के बीच में? Then? हाँ. Then?
If we'll check for air bubble, tap.
Check for air bubble. You have to tap it to release the air bubble.
Tap to release air bubble.
What you're saying?
Then if there is any excess
Air bubble is still there, madam. Then correct the dose. Correct it.
Correct the dose.
Then
We'll find the site.
how will you find the site?
In case intramuscular, so it will be 2 fingers above.
2 fingers above? 2 fingers below the abdomen process.
2 fingers below the abdominal process.
Okay.
Then
1 inch or 2 finger. Okay.
we will introduce.
Mark the location.
Then we will introduce the needle in 90 degree. And
How do we hold it?
or skip any steps.
This way.
Oh, pin.
How are you holding this? Pen or dart, okay? Then angle is with
90 degree.
you are present, you are saying, and you are doing all the steps. I am so saying all the steps correctly. No, wait.
Each and every steps.
Simple like this. We introduce. Any technique?
Z, not P.
Z track.
Z track.
What is the Z track? ना Z track में क्या है? Forgot. ये तो तुम locate कर लिया. You have find the location, the area. When you will introduce the needle. Z track forgot. You have to stretch the skin laterally. Stretch the skin laterally. Now, which is the lateral side?
Shall I show one more time?
If suppose this is the lateral side. No, not like this. Stretch it laterally. Not like this. This like this. Like this stretch. Okay. Why? Why? Any advantage of this? All gone. Huh? So volatile. I have taught you so nicely. Okay, do it. Stretch it and then introduce. There is an advantage of this. Okay. When we stretch the skin on the subcutaneous tissue laterally and then we insert the needle. Okay. After introduction, what we do? Next is what? We withdraw. Okay. Because muscle is vascular. Okay. Then if blood comes,
We'll remove the needle and relocate another side.
If not, then
we'll introduce.
stretch should be still there. Okay, don't leave the stretch. You have to be slow. Okay. 30 to 2 minutes. 30 seconds to 2 minutes. Okay. Very slowly you have to introduce it. Then release the stress. Okay. Then apply a cotton or gauze. Press the area. Okay. Then wait for few minutes.
To see any
adverse reaction. Okay. If the patient is comfortable, greet the patient. Okay. Then
cap the needle and discard.
Don't cap. Discard it. Okay. According to the waste management. Okay. Then remove the gloves.
Remove the gloves
And then last step is hand wash. Okay. So here is an advantage of this Z track. What is the advantage? When we directly insert a needle, okay, into the muscle, okay, there is a space for the tissue fluid to come out or leak. So this creates a temporary blockage. Okay, because when you are stretching it, you are shifting the skin laterally. You are inserting the needle, and after introduction of the drug, the needle is being brought out. Okay, then you release the skin. So what happens? The fresh skin comes and covers the area. Okay, that way the spillage or leakage is not there. Okay, so this is the advantage of the Z track. Okay, so this is the IM. Okay, next is SC. Acha, where you come? How to do the SC? What is the angle?
45 degree.
45 degree. Okay, then
We have to slightly pinch.
the area. Okay, that is lift skin up or lift skin up technique. Okay, you have to slightly pinch here. Okay, then so before pinching you have to disinfect the area. Okay, then only then
Then we have to
okay, suppose you are taking the suppose this is the vial. Okay, अच्छा ठीक है. Okay, show. Take the first load the solution. You are going empty. First load the solution.
first we have to disinfect.
Just the step. Okay, just load the medicine. Not like this. This labeling is same. Okay, for SC, IV and IM. Okay. What do you have to do? You have to insert the air first, isn't it? Then load. ठीक है.
Then we have to check for the air bubble.
Then
Then we have to locate the side, disinfect the side. Then we have to slightly pinch the skin. In 45
লাগবো একটি আছে খুব দিলাম না একটা এটা নিস না এটা না, এটা তো ভালোই। হ্যাঁ কি
অলরেডি এরিয়া নেট
কি ঠিক আছে তো এটা?
हर में बराबर होना चाहिए except for the ones in which you're going to give 90%. उसको bevel का upwards का
Then?
tension करते हैं।
Now
बाकी सब में upwards होना चाहिए।
the bevel should be facing upward.
ठीक है।
45 degree.
So in SC do we need to withdraw?
So the blood doesn't.
So the SC is having, the muscle is more vascular, the SC is less vascular, but still there are chances. Okay, so to avoid it, it is better. Okay. Okay, go.
Now slower than I am. Slower than I am. Very slowly.
Then
You have to remove the cordings first.
then
Then we have to discard the.
cover the area with the cotton. Okay.
Then we have to discard the material.
Then?
And then we'll wait for any reaction. Then
Greet the patient.
greet the
Reassure the patient. Then remove the gloves. Dispose it. And the last step is.
hand washing.
Okay. You come. You show IV. You show IV. কি লাগবে বল? IV. This is cannulation. This is for cannula.
मीडियल क्यूबिटल वेन
हाँ मिडिल क्यों अच्छा ठीक है First steps, okay, it is same for all, okay.
It's 25 degree, I think.
25, acha. Then others see if there is any mistake, try to correct. Then before taking the drug, you have to check the in level. Everything comes. Okay, when you're saying level means everything. Okay, about this. Take it. This way you are taking the drug. How to take the drug? You have not taken. Where should be the plunger? Where should be the plunger? Plunger. Which part is known as the plunger? Which part is known as the plunger? Hey. Why are you using only one hand? Have you got the prick? Huh? Have you got prick? Have you pricked yourself?
No, sir.
Where should be the plunger? How much you will take?
More than 1 ml.
How much?
1.1.
No. Again you are going wrong. नितिन क्या बोल wrong कर रहा है? हाँ. First you have to insert air, isn't it? Air. Same amount of air. How much solution will be taking? Same amount of air. Now go. Now push the air inside. Now take. Remove. Then correct the solution. Okay. Now
Then aseptic precaution.
If you're making the solution ready, you have to recap it. Okay. Primary, first is you have to locate the site. You have to disinfect the area. Okay. Before using this cotton soap, alcohol soap. The tightness should be
Not so.
This is for what? This is for cuff. The tightness should be what? Tightness should be? You are bringing which theory and here? Physiology and pharmacology. It should be not too tight, not too loose. Then
The other side.
So the middle cubital vein is located in the cubital fossa.
अच्छा.
Inside the outside.
The other side. Other side.
How many times?
3 times.
Then
Angle is 28.
the vein is dilated.
If the vein is not seen, then she will do this.
Make fist and release. Achha. Then if still not,
Then I should try this.
no. You can tap. Then, if not still, then you can apply warm solution.
Home solution.
Huh? अभी for? अच्छा जाओ. हाँ हाँ ठीक है जाओ. Then angle is जाओ. What is the any technique here we do? Any technique we do here for IV?
The blood will be
Facing upwards.
And technique, not the direction of the needle. This is the angle. Technique means what?
we have to feel the vein.
Huh?
We have to feel the vein. So technique. At distal to proximal,
We have to stretch the skin, okay, towards the direction of the vein, okay, towards the direction of the, like this, okay, like this. We have to stretch the skin, and then we have to enter. You have to. The stress should be there. Okay. Now. No. Wait.
check if this area is
No. Wait. No. Wait. Now what?
we have to check for the blood.
Will?
Check for the blood will appear here. Abhi tourniquet.
Do we need to?
Tourniquet.
Do we need to withdraw?
No, air bubble.
Do we need to withdraw here? Do we need to aspirate?
अपने आप आएगा ना, ये नहीं देना है, अपने आप आएगा.
So the blood will appear in the hub here. Okay. Then
Then I will press.
if it doesn't come,
Then I will remove and
then you can adjust the angle. Okay, you can adjust the angle. Okay. Then if it is still, then we have to go to the another fresh site. Okay. Then suppose blood came, then
press slowly. Tourniquet खोलते हो.
you have to leave the stretch first of the with the non-dominant hand, from the non-dominant hand. Yes. Then remove the tourniquet. Remove it with one hand. You can do it. Now don't leave this. Now what is the speed of this introduction? For IM it is 30 to 2 minutes. That is slowly. Here you should be very slow. Okay. Go. When you will be introducing the medication in the vein, anything you need to keep in mind? Anything you need to keep in mind when you're not there? Anything we need to keep in mind? If there is pain,
or swelling.
if there is swelling, if there is any hematoma formation, okay, will we go or will we remove? Yes, we have to remove it. Okay. Then cover the area with the cotton. Remove it. Then
Now discuss.
Then wait for few minutes to see whether the patient is comfortable, whether there is any adverse reaction. Then if there is not, reassure the patient, greet the patient, then remove the gloves. Last is hand wash. Okay. Come next. Want to come? It is already time 5.
Already 5.
Cannula?
Absent.
Who was present?
दीक्षा भी absent थी. You? मैं भी absent थी. Present थी. Yes.
आ जाओ. Who was present? Come. हाँ आ जाओ.
बस process पता है.
Cannulation.
उस दिन बहुत जल्दी छुट्टी हुई.
Cannulation.
और पूरा पहले aseptic precaution.
करो. Do it. Aseptic.
Quint लगना है.
करो. Do the aseptic purification first. Then.
Inside 2 hours.
How many times? Easy. How many times?
One time only.
One time? 3 times. Okay. Your friend is getting you. Okay. 3 times. So it's same swab or fresh? Same swab or fresh?
Fresh swab.
Then? Remove it. Yes, remove it. Take this one. Take this one. There is also, I think. Okay, just do it.